Every pet owner just wants their furry friend to be happy and healthy, right? But what happens when an illness is, well, super subtle, almost like a spy hiding in plain sight? Today on the deep dive, we're looking into something called Addison's disease in pets. It's actually got this nickname, the Great Pretender. Yeah, it's not super common, but it's definitely serious, so it's really worth understanding. Our goal today is basically to pull out the most important stuff you need to know about Addison's. We've gone through quite a bit of material, veterinary sources, owner experiences, and we're going to distill it all down for you, give you the key facts without drowning you in, complex medical terms. Okay, so let's dive in. What exactly is this thing, Addison's disease, and why should pet owners listening right now really pay attention?
Right. So medically, the term is hypoadrenocorticism.
Bit of a mouthful.
It is. But basically, it's an endocrine disorder. It means the adrenal glands, these two tiny glands sitting right near the kidneys, they just aren't making enough of some really essential hormones. Think of them as the body's natural control center for stress and balance.
Okay. Essential hormones, like what specifically are we talking about?
Good question. Mainly two types. Glucocorticoids, cortisol is the big one there, and mineralocorticoids, like aldosterone. Cortisol helps manage stress, inflammation, energy levels.
Yeah.
It's vital day to day. And aldosterone, that manages the body's salt and water balance. Super important for blood pressure, hydration, kidney function, all of that.
Wow. Okay. So if those aren't being produced.
Yeah, if it's left untreated, it can unfortunately be life-threatening. But, and this is the really crucial part, if you get a proper diagnosis and stick with the treatment plan, pets can live long, happy, totally normal lives. Absolutely.
That's really good to hear. And we're mostly talking about dogs today, I gather.
Primarily, yes. It's much more common in dogs. But it's worth mentioning, it can happen in cats, though it's very rare.
And probably even harder to spot in cats, knowing them.
Exactly. Even more subtle. But for any pet, the big question is, what actually causes this? Why do the glands stop working properly? Are there different ways this can happen?
Yeah, what triggers it?
Well, we usually classify it based on the cause.
Yeah.
The most common form by far is primary Addison's disease. This is usually when the pet's own immune system gets confused, basically, and attacks the outer layer of the adrenal glands, the cortex. It destroys the tissue that makes the hormones.
An autoimmune issue, then?
Pretty much, yeah. Less often could be from things like infections, trauma to the glands, even cancer, or sometimes certain drugs can damage them.
Okay, so that's primary. You said there were others.
Yes. Then there's secondary Addison's disease. Here, the adrenal glands themselves might be perfectly healthy. The problem is actually upstream in the pituitary gland in the brain. It's not sending out enough of a signal hormone called ACTH.
ACTH, that's the one that tells the adrenals to work.
Exactly. It's the on switch for cortisol production. No signal, no cortisol, even if the factory's fine. Then there's iatrogenic Addison's. This one is, well, caused by medical treatment. If a pet is on steroid medications, like prednisone, for a long time, their own adrenal glands kind of go to sleep because the body's getting steroids from the pills. If you stop those steroids too suddenly, the glands can't wake up fast enough to start producing their own cortisol again. We have to taper the dose down slowly to prevent this.
Okay. That makes sense. And there was one more.
Right, atypical Addison's. This is sort of a variation where only the cortisol production is affected, not the aldosterone, initially at least. The electrolyte balance stays normal, so some of the classic signs might be missing. But it can sometimes progress later to the typical form involving both hormone types.
Interesting. So multiple paths leading to this hormone shortage. That leads to a key question. Are some pets just more likely to get this? Like, are there risk factors?
There definitely are. Age is one. We usually see it diagnosed in younger to middle-aged dogs, say typically between 2 and 6 years old.
So not usually puppies or very old dogs.
Less commonly, yeah. Gender also seems to play a role. It's more common in female dogs. And then breed is a big one. There are definitely breeds that are predisposed.
Like which ones?
Standard poodles are high on the list. Portuguese water dogs, beardies, bearded collies, Nova Scotia duck-tolling retrievers, also Great Danes, Westies, West Highland White Terriers, and soft-coated Wheaten Terriers. If you have one of these breeds, it doesn't mean they will get it, of course, but the risk is higher.
Good to know. And just circling back quickly to cats, still very rare, still tricky to diagnose.
Exactly. Very rare, very subtle signs.
Okay, so let's talk about those signs. You called it the Great Pretender. What should owners actually be looking out for? Why is it so sneaky?
It really is sneaky. The biggest challenge is that the symptoms are so vague, they look like 100 other things. And crucially, they often wax and wane. They come and go.
So one week the dog seems lethargic, maybe throws up, then the next week they seem fine.
Precisely, which makes it easy for an owner or even a vet initially to think, oh, maybe they just ate something funny, or maybe this is just an off day. It delays getting to the real answer.
So what are these vague signs?
Things like just general lethargy, weakness, vomiting is common, so is diarrhea, poor appetite, maybe losing weight without trying. Sometimes you might see shaking or trembling, dehydration, even if they seem to be drinking.
Drinking more.
Sometimes increased thirst and urination. Yeah, paradoxically, even while dehydrated, a vet might pick up on a slow heart rate, bradycardia we call it, or the pet might just seem painful in their abdomen.
It sounds like a list that could fit so many illnesses.
Exactly. That's why it's the great pretender.
So if those signs are just sort of simmering along, maybe coming and going, is there a point where it suddenly gets much, much worse, like a real emergency?
Yes, absolutely. That's what's called an Addisonian crisis, and it is a true life-threatening emergency.
What does that look like?
It's often sudden collapse. The pet goes into shock. This is because of severe dehydration, critically low blood pressure, and really dangerous imbalances in their electrolytes. Particularly, the potassium level can shoot dangerously high, which can affect the heart.
That sounds terrifying.
It is. It requires immediate, intensive veterinary care. No waiting around. Straight to the vet or emergency clinic.
Okay. Wow. So this brings up a really important point you touched on earlier. If the day-to-day signs are so easily missed or mistaken, how do vets figure this out? How do you diagnose something so tricky?
Yeah, it's a process. It definitely starts with a really thorough physical exam and, just as importantly, listening carefully to the owner's history. What have you been seeing at home? Those waxing and waning signs are a big clue.
So the owner's observations are key.
Invaluable. Then we move to tests. Blood work is usually the first step. A CBC, complete blood count, and a biochemistry profile. We're looking for characteristic changes. The classic one is low sodium and high potassium, hypernatremia and hyperkalemia. That's all balance being off.
Right, the aldosterone effect.
Exactly. We might also see low blood sugar, hypoglycemia. Sometimes markers for kidney function, like BUN and creatinine, can be elevated, which can confuse things with kidney disease initially, maybe mild anemia. But that ratio of the sodium level divided by the potassium level, if it's low, often like less than 27-1, that really raises a red flag for Addison's.
Okay, so blood tests give clues. What else?
A urinalysis is usually done too. Sometimes Addisonian dogs have surprisingly dilute urine for how dehydrated they might seem, which again helps differentiate from primary kidney failure. But the definitive test, the one that confirms it, that's the ACTH stimulation test.
The gold standard you mentioned, how does that one work?
So we take a blood sample to measure the dog's baseline cortisol level. Then we inject a synthetic version of that signal hormone, ACTH.
The one that tells the adrenals to make cortisol.
Right. Then we wait an hour or two and measure the cortisol level again. In a normal dog, that ACTH shot causes a big surge in cortisol. But in a dog with Addison's, their cortisol level stays low or barely budges. The adrenal glands just can't respond to the signal. That confirms the diagnosis.
Okay, that sounds pretty conclusive. Any role for imaging, like x-rays or ultrasound?
Ultrasound can sometimes be helpful. It won't diagnose Addison's on its own, but we might see unusually small adrenal glands in affected pets. It's also useful to rule out other things that could cause similar signs, like tumors.
Got it. So you've gone through the history, the blood test, the ACTH stim test, and you finally unmask the great pretender. What happens next? What does treatment involve? Is it manageable?
It is absolutely manageable, but it is typically lifelong treatment. It focuses on replacing those missing hormones.
Okay. What about that crisis situation first? If a pet comes in collapsed?
Right, the Addisonian crisis. That's an emergency requiring intensive care. Lots of intravenous fluids are crucial to correct the dehydration, bring up the blood pressure, and start fixing those dangerous electrolyte imbalances, especially the high potassium. We also give fast-acting corticosteroids, usually in injectable form like dexamethasone initially, and close monitoring, especially of the heart, is vital.
Sounds intense. Do dogs usually recover from that crisis?
The good news is yes, with prompt and aggressive treatment, most dogs pull through an Addisonian crisis remarkably well. Sometimes they look dramatically better within hours once the fluids and steroids kick in.
That's a relief. Okay, so once they're stable, what about the long-term day-to-day management?
That involves ongoing medication, usually two types. They need a daily glucocorticoid replacement, typically prednisone or prednisolone pills. And the dose often needs adjusting. Owners learn that during times of stress, like if the dog gets sick with something else, needs surgery, or even just goes to boarding, they might need a temporary increase in their prednisone dose. Your vet helps guide that.
Okay, daily pills for the cortisol replacement. What about the other hormone, the aldosterone?
For the mineralocorticoid replacement, there are basically two main options. One is an oral medication called fludrocortisone, brand name Florinef. It actually has both mineralocorticoid and some glucocorticoid activity. The other option, which is often preferred now, is an injectable medication called DOCP desoxycorticosterone pivalate. Brand names are Percortin V or Zyquiltor.
An injection? How often?
It's a long-acting injection, usually given by the vet about once a month, roughly every 25 to 30 days. Pets on DOCP typically still need a small daily dose of prednisone as well, since DOCP only replaces the mineralocorticoid.
Okay, so either daily pills or a monthly injection plus daily pills.
Yeah.
It sounds doable, but definitely a commitment for the owner.
It is a commitment, no doubt, giving medication every day or remembering those monthly vet visits for the injection.
So what does this really mean for the pet's quality of life, and what are the practicalities for the owner?
That's the best part, really. With the right treatment and consistent monitoring, the prognosis is generally excellent. Most dogs respond incredibly well. They go back to being normal, active dogs, running, playing, enjoying life. Quality of life is usually very, very good.
That's fantastic to hear.
It really is. The owner's role becomes crucial, though. It's a partnership with the vet. You absolutely have to be vigilant about giving the medication on time, every time. You also become attuned to your pet learning to recognize subtle signs that might mean they're stressed or feeling off, which might signal a need for temporary dose adjustment of the prednisone. Communication with your vet is key.
And regular checkups, I assume.
Oh, definitely. Especially early on, and then usually every 3 to 6 months long term. We need to monitor their electrolyte levels with blood tests to make sure the mineralocorticoid dose, whether it's Florinef or DOCP, is just right. Sometimes dosages need tweaking over time. Occasionally, a dog might start on fludrocortisone and then switch to DOCP later if regulating the electrolytes becomes a bit tricky. There are options.
So living with it means consistency, monitoring stress, regular blood work.
Exactly. Consistency with meds, watching for stress, keeping up with vet checks and blood tests. It's also smart to have an emergency plan. Some vets provide owners with an injectable steroid to have on hand for emergencies, especially if they travel. Keeping a little log of how your pet is doing day to day can be helpful too. And again, just keeping those lines of communication open with your vet.
And quickly, for cats, again, same principles apply if they do get it.
Broadly, yes. The diagnostic tests are similar, and the treatment involves hormone replacement, just with cat-specific dosages and maybe slightly different monitoring protocols. But it's so rare, most vets encounter it very infrequently.
Okay. So, wrapping this up then. It seems like while Addison's disease is definitely uncommon, maybe even rare,
Relatively uncommon, yeah.
it's something really important to be aware of because if you do catch it and you're diligent with the lifelong management, most pets can really thrive. It's not a death sentence by any means.
Not at all. It becomes a manageable condition rather than a devastating illness. They can live full, active lives.
We talked a lot about it being the great pretender, hiding its symptoms. But it sounds like knowing what those vague signs could be, knowing about the diagnostic tests, especially that ECTH stim, it really empowers earners, doesn't it?
Absolutely. It turns you from just a worried observer into an informed partner in your pet's healthcare. You know what questions to ask, what possibilities to discuss with your vet.
You know, it makes you think. Understanding a tricky mimicking disease like this isn't just about Addison's itself. It kind of highlights how important just watching your pet closely, noticing those small changes, and really partnering with your vet is for any health issue, right?
That's a great point. That persistent observation, that trust and communication with your vet.
Yeah, it seems like that vigilance, your collaboration, that's what really makes the difference in turning what could be overwhelming worry into confident care for these companions we love so much.
Well said. It really does make all the difference.